Yeah, hi, it's Jake with River Records. I want to show you today our chronic care suite of tools that are embedded within Stream. There are a few different aspects to Stream which facilitate better long-term care documentation. First, and probably most importantly, Stream manages clinical documentation over time, which means that you never have to start from scratch once you've seen a patient in Stream. We manage a problem list alongside your patient and you, and we provide for micro updates, meaning when a medical problem has been addressed in the past, you don't need to redocument everything that's there. You can simply update essentially what's happened before. Additionally, we have the ability to show you the differences between today's documentation and yesterday's documentation. And lastly, we have the ability to recap problems that have been documented within Stream. So I'm going to go ahead and show you some of these features now. So we're going to start a new encounter for a patient that I've seen a few times before. We're going to come into the main workspace here, and I'm going to have the ability to start recording just as I would normally, or review things that have happened in the past. So I can look at asthma, hypertension, and routine healthcare maintenance. For the patient's asthma, it looks like he had an asthma exacerbation recently that was resolved. He was diagnosed a few days ago. He was started on prednisone, and it seems to be doing well. For his hypertension, it seems like it's been well controlled. And for routine healthcare maintenance, it looks like we have a lot of work to do. So we'll do some routine healthcare maintenance today. Homer is returning to clinic today for an annual physical. Routine healthcare maintenance is pretty out of date. Blood pressure today is 122/82, so well controlled. He is on medications for hypertension. I'd like you to make sure that you include any prior medications for hypertension in the updated documentation today. We're not making any changes today. He hasn't been tested for hepatitis C or HIV, so we're going to be doing both of those today. Additionally, Homer is 50, so he is past due for his colon cancer screening. He opted for a colonoscopy, which I've ordered. He does not smoke any cigarettes, so he does, and he's never smoked cigarettes in the past. He's not due for lung cancer screening as a result of that. He does not require AAA screening, and he's not going to be screened for osteoporosis today. For his COVID vaccines, he is up to date. He had one a week ago. For a flu vaccine, he declined, not due for RSV. I gave him a PCV20 pneumococcal vaccine today, and his tetanus vaccine is up to date. He thinks in the last 2 or 3 years, so nothing to do. And I encouraged him to get his shingles vaccine at a local pharmacy, which he reports that he'll do. Otherwise, nothing else going on. No blood work needed today. For his hypertension, we'll make sure he follows up in 4 months. So I'm going to go ahead and stop recording. Now, you can use Stream either as a dictation software, as I've just done, or what we call kind of pseudo dictation, or you can use it in the background ambiently with your patients. Either way is fine. You can also use it in combination. You can do some ambient dictation with your patients, or just talk to Stream as you would a real human scribe. You'll note that I didn't explicitly tell it the medications for hypertension that Homer's taking, notably amlodipine and lisinopril, but it should be able to still keep that information fresh because we're managing that problem over time. So I'm going to go ahead and generate the medical problems that we are going to have addressed during this visit. Great, and it notes hypertension. I'm going to take off that template because I don't want it. And we're going to have the routine healthcare maintenance template and the after visit summary, and we're going to go ahead and generate documentation for this particular visit. And you'll see correctly that the hypertension is noted to continue amlodipine and lisinopril. It looks like we've got all of our data for the routine healthcare maintenance up to date here now. And our after visit summary is done as well. And so just a minute 29 seconds here of recording, as you can see here, and I've got essentially my full updated note that includes prior information like the medications the patient was taking. I can show you the differences now in sort of what was done previously right? So chief complaint prior was follow-up on asthma. Now today it's annual physical. Let's see. Potassium last time was 4.2. That's not relevant today, so it's been removed. No data for labs or physical exam. We're going to follow up in 4 months, but you'll see this medication data is still there and not changed. And now there's a lot more information explicitly included within the routine healthcare maintenance section. Lastly, I just want to show you what we call recap. So I can go into the hypertension problem here, and I can see that there are two cards or sections of documentation that have addressed hypertension in the past, and I can just click recap, which is going to give me a brief summary essentially of those old bits of documentation. So as of April 4th, Homer's hypertension was well controlled, and on April 9th, his hypertension remains well controlled. So we've gone over a micro update, the ability to recap information, and the ability to show differences in stream. Really excited to show you these features. I hope that you'll reach out, get on a free trial, or schedule a demo with one of us. Thanks for listening.